Hello, my name is Dr. MarkAlain Dery, and I am the Medical Director of Infectious Diseases and the Chief Innovation Officer for Access Health Louisiana, the largest Medicaid providing clinic system in Louisiana. I'm also the co-chair of the ACOI Infectious Diseases Subspecialty Section. Along with the leadership of the ACOI, we want to thank you for all that you're doing as we face this unprecedented time in medicine fighting the COVID-19 virus. Moving forward, and in conjunction with the ACOI, we want to share with you some information as it becomes available, as well as some bright spots that we are seeing so we all can feel some hope in these trying times. So the first bit of news is basically that it seems as though Americans are not comfortable returning back to normal. So as we're moving into May and we're seeing states that have decided to ease up on their shutdown orders, not really seeing that here in Louisiana, thankfully, but I know that states like Georgia, Nevada, Texas, and others are opening up for business, and yet they're also being asked to open at decreased capacity. Some of those states, however, as they're easing restrictions, are unfortunately doing so despite seeing increasing cases. This is worrying healthcare workers who are concerned that it means that we haven't hit the expected peaks yet. And so opening too soon will mean that people will remain indoors longer and that there will be continued outbreaks, and that this ultimately may stress the healthcare system. Government estimates also just released show that the pandemic could in fact actually result in over 100,000 U.S. deaths. Yet there are these fringe groups that are protesting, and in Michigan, and there are even reports of armed protesters, but is America even really ready to get back to living life as we're accustomed to? A poll released by ABC News just a few days ago indicates that only 44% of Americans are ready to eat at a restaurant, and only 29% of them are willing to go to a health club. From the beginning, I've been saying that patience, which is not something that we are naturally good at, is what we are going to need to weather this storm. And my feeling is that we are not at all through this storm, and so we really do need to remain patient. So let's talk about the IDSA. A few weeks ago, we reviewed the Infectious Disease Society of America, also known as the IDSA, treatment guidelines for COVID-19, and I explained that they were living guidelines and they would change with time as new data becomes available. Well, today I am so happy to report that the IDSA has added infection prevention to their menu of COVID-19 guidelines. Like the treatment guidelines, these will be updated as new data is made available. The purpose of these guidelines are to provide evidence-based recommendations for what PPE to be used to use in conventional, contingency, and crisis standards of care. The results are that the guideline panel agreed on 8 recommendations, and I will summarize them below. But again, I do want to reiterate the fact that these were for conventional, contingency, and crisis standards of care. So you're going to hear me say that. So for recommendation 1, in conventional settings, the IDSA guideline panel recommends that healthcare personnel caring for patients with suspected or known COVID-19 use either a surgical mask or an N95, an N99, or a PAPR respirator as part of appropriate PPE. Routine patient care in contingency or crisis capacity settings. Recommendation number 2 is that during contingency or crisis capacity settings, for example, as in the setting of a respirator shortage, the IDSA guideline panel recommends that healthcare personnel caring for patients with suspected or known COVID-19 use a surgical mask or reprocessed respirator instead of no mask as part of the appropriate PPE. So for routine patient care in conventional, contingency, or crisis capacity settings, this is recommendation number 3. The IDSA guideline panel makes no recommendations for the use of double gloves versus single gloves for healthcare PPE. Number 4, the IDSA guideline makes no recommendations for the use of shoe covers versus no shoe covers for healthcare personnel caring for patients with suspected or known COVID-19 as part of their PPE. So now let's talk about recommendation 5, which is in the setting of aerosol generating procedures. So this is in the conventional setting for aerosol generating procedures. Recommendation 5 is that the IDSA guideline panel recommends that healthcare personnel involved with aerosol generating procedures on suspected or known COVID-19 patients use an N95, N99, or PAPR respirator instead of a surgical mask as part of their PPE. For, again, aerosol generating procedures in contingency or crisis capacity settings, recommendation number 6 is that during, again, contingency or crisis capacity settings, i.e. respirator shortages, the IDSA guideline panel suggests that healthcare personnel involved with aerosol generating procedures on suspected or known COVID-19 patients should use or can use a reprocessed N95 respirator for reuse instead of surgical mask as part of the appropriate PPE. Recommendation number 7 says that the IDSA guideline panel recommends that the healthcare personnel involved with aerosol generating procedures on suspected or known COVID-19 patients add a face shield or surgical mask as cover for the N95 respirator to allow for extended use as part of appropriate PPE. And then finally, recommendation number 8, again during contingency or crisis setting, again in the setting of a respirator shortages, the IDSA guideline panel suggests that healthcare personnel involved with aerosol generating procedures on suspected or known COVID-19 patients add a face shield or surgical mask as a cover for the N95 respirator to allow for reuse as part of appropriate PPE. And again, you can find these guidelines at the IDSA website. They're also attached to the link below on this YouTube channel. That'll take you back to the ACOI website where you'll find the links for that. Lastly, we're going to very quickly talk about COVID and cancer. As if cancer patients don't already have enough to worry about, there's evidence now that those with or suspected of having cancer are avoiding healthcare services both in the US and in the UK. Data has recently been revealed that has shown there's been major declines in chemotherapy attendances, measuring on average about 60% decrease from pre-pandemic levels. This study, which has yet to be peer-reviewed, calculates that we will see additional cancer deaths as a result, since early diagnosis and treatment is really what saves lives. One reason these individuals may be avoiding care is that it is well known that those with underlying health conditions are, of course, at a particular risk for this virus. So this is an increase in death for those people living with cancer during this crisis, and it's likely not going to be due to contracting the COVID-19 virus, but due to the unintended health consequences of changes in seeking needed treatment, or even possibly the physical or psychological effects of social distancing, and also even possibly the results of economic disruptions. So this is just one chronic condition that we need to keep our eye on as more studies are released, even about other chronic conditions. And I just want to say lastly here that I remain humbled, and I honestly do, as we watch the progression of the scientific understanding of this pandemic. And it seems almost like every day we learn something new, different, or even something that contradicts something that we knew last week. So please stay on the lookout for our regular updates, and to read more from the sources used in this report, again, you can go to acoi.org/COVID-19. Together with the ACOI, we will help you have the latest information to help you respond to your patients and to stay on top of this crisis. Please feel free to reach out to me anytime at madery@mac.com. Please stay safe. We can do this together.